Okay, let's talk about the dangerous segment. Ooh, danger. The PID segment. Messages in administrative and clinical areas use the PID segment to transmit core identifying and demographic information about the patient. In simple terms, the PID segment contains all the information about the patient. Danger. Information contained in the PID segment could potentially be used to identify a patient and must be safeguarded in accordance with local, state, and federal regulations, including the HIPAA and Privacy Act. In other words, if you are having an interface problem and you think it might be in the PID segment and you grab a couple messages from your log file and send it to your vendor, well, you've just committed a HIPAA violation. You can't send your vendor patient information, even in an HL segment. You can't do that. In the same way you have to safeguard their records, you have to safeguard their identity, even if it can be identified through something as simple as an HL7 message. So always be sure to blank out, mark out, don't share the PID segment. Figure some way to obscure that data when sharing that outside of your business. So the important fields are, the fields most commonly used in the PID segment are PID3, the patient identifier list, PID5, the patient name, PID7, date, time of birth, PID8, sex, PID10, race, PID11, patient address, PID18, the account number. PID3 is a required field. PID3 will have the patient's medical record number and sometimes their master patient index number. A medical record number is assigned to a patient's medical record at one particular facility. A master patient index number is assigned to a patient in a healthcare enterprise. So let's say you get your healthcare at Hack Health System. When you go to the Lancaster Hospital, you'll have a medical record number for that facility. When you go to the York Hospital, you'll have a different medical record number there. When you go to the Gettysburg Hospital, you'll have still a third MRN. However, no matter what facility you go to, you will only have one unique master patient index number, or MPI, that can identify you and your cumulative medical records across all facilities, right? So your medical records at the York Hospital will be for the York Hospital. Your medical records at the Gettysburg Hospital will be for the Gettysburg Hospital. But the MPI will connect all of those together into one larger medical record. PID5. PID5 is a required field. PID5 contains the patient's full name. PID5 is always divided into components for the last name, first name, middle initial, etc. Exactly how PID5 is divided up into components depends on what version of HL7 the system is using and how many different elements there are in the patient's name. Have you ever heard of a soccer player named Pele? Well, his full name is Edson Arantes do Nascimento. So does his PID5 have one element and say Pele? Or does his PID5 have a whole bunch of subcomponents where his first name is Edson, his middle name is Arantes and Do, and his last name is Nascimento? So obviously which name of his was used in PID5 would have an effect on how many components in PID5 there were. PID7 is not a required field by HL7. However, it is required by IHE. IHE is something we'll cover later this semester. Just keep in mind that some fields can be optional by HL7 standards, but required by IHE standards. PID7 contains the patient's date and time of birth. PID8. PID8 is not a required field by HL7. However, it is required by IHE. PID8 contains the patient's administrative sex. Administrative sex, that's the sex used to assign a patient to a bed in a room shared by patients of a single sex. If you are assigning a room in the women and babies wing of the hospital, well, you're going to want to assign people who have an administrative sex of F for female to that wing. Just because PID8 says the patient is male, female, other, it is not the clinical sex or the clinical gender. So PID8 has become controversial in the last few years. As different systems expand the list of possible gender designations, it causes compatibility issues. Systems solve these issues by expanding their own list of genders or creating matching logic. In other words, a gender value of T in the hospital information system would be mapped to a gender value of O in the PACS system. Here are the common gender values for each system. The most commonly used hospital information system in the country is Epic, and the values it puts in PID are M for male, F for female, T for transgender, and U for undifferentiated. However, DICOM, which is what all the PACS systems use, only supports F, M, and O. And IHE recommends F, M, O, U, A, and N. So there's a lot of discussion in the world today about what people identify as. Some people identify as male, female, transgender, other. There are people in the world who identify as cats. You can YouTube that one if you want. So doesn't matter what they identify as. These are the choices we have in the programming world. And we have to make all of these work together. So if you identify as whatever, and in his system you get a U's got to map to an O, and when DICOM sends to IHE, that O has to map to an O or back to a U. However it gets worked out, these are the choices we have to work with. PID 10. PID 10 is not a required field by HL7, however it's required by IHE. PID 10 contains the patient's race. PID 10 is used in the USA to track and monitor access to care by patient race. However, in many other countries, it is against the law to populate PID 10, and you can be subjected to a serious fine for doing so. If you send messages to other countries, be sure to blank out the PID 10 field. Does this really matter? I mean, how many interactions do we have with other countries? Seems silly, right? Well, consider this. Lancaster General uses McKesson PACS system. The McKesson PACS system has an East Coast and a West Coast help center. If you need help on the East Coast with your McKesson PACS, you call the help center in Toronto, Canada. If you need help with your McKesson PACS and you're in the western half of the country, or Hawaii, you call the West Coast Help Center, which is in Vancouver, Canada. If you didn't know this, Canada is a different country. And so if you need to send information to your McKesson vendor because you're not getting a particular patient record into your system, and you send them PID 10, well, populating PID 10 is illegal in Canada. You just broke Canadian law, and you can be fined for breaking Canadian law. So this isn't just something I threw in there to make a fun test question. This is an important point. If you have a McKesson PACS system, your data will go to Canada and be subjected to Canadian law, and if you populate PID 10, you can be fined for it. So stay out of PID 10. PID 11 is not required by HL7, however it is required by IHE. PID 11 contains the patient's address. PID 11 usually has several components based on the HL7 version and how many addresses the patient has. PID 18, not required by HL7, is required by IHE, contains the patient's account number. So this is interesting. As we start to talk about more and more about these standards, the DICOM standard, the HL7 standard, the IHE standard, you will see that not all the standards are standard. That's right. So HL7 says we don't need that in our standard, but IHE says we do need that in our standard. So you have some conflicts amongst the standards. Consequently, things become non-standard. Here's a PID segment in action. Whoa! Try not to get too excited. So here's our whole PID segment. Here's PID 1. Here's PID 2. They're both blank. Here's PID 3. That's the patient identifier list. So that's PID 3. It's an MR number. Here's PID 4. This is one of the optional fields in this particular message. It is an alternate patient ID. This is a good place to put an MPI number. So that's PID 4. Here's PID 5, the patient name, broken out by our component separator. Here's PID 6, blank. PID 7 contains patient date and time of birth. PID 8 contains sex. 9 is blank, 10 is blank. 11 contains the patient address. It goes all the way over to here. PID 12, blank. PID 13, home phone number. PID 14, work phone number. PID 15 is blank. PID 16 is marital status. PID 17 is religion. PID 18, as we know, requires the account number. And PID 19 is the social security number. So in this message, you can see that even though they're not required, they're using several optional PID fields to gather a lot more data about the patient. And the more data you have, the more things you can do with it, the more you can figure out, things like how many single Christians were admitted to the hospital today. So they're using PID 4, 13, 14, 16, 17, and 19 as optional PID fields to gather more data. Thank you for watching.